Hi, I'm Sali Hughes and welcome back to sallyhughesbeauty.com. We have a really interesting video for you today, one that I've wanted to make for a really long time. I've been talking about this for several months. The reason I wanted to make it is because I have found increasingly, pretty much every time I do an event, somewhere around the country or in Ireland, somebody stops me at the end and asks me about injectable beauty treatments. Where can they go? What should they cost? Who should they see? And so on. And while I always tell them I have no opinion on whether they go for an injectable beauty treatment or not, I really think a woman should do whatever she wants to her face. What I do feel strongly about is that she should be informed and educated and most of all safe. And so what I really wanted to do is try and answer some of the questions I hear most often, but with a professional doctor who does this all day long and who is in a position to offer advice on this complex medical treatment. And so I really want to talk about that today. So I'm with Dr. Tapan Patel at the Phi Clinic in Harley Street. And now I'm going to throw lots of your questions over to Dr. Patel. Now, Tapan, what have you observed in the past few years? It feels to me as though suddenly lots and lots and lots of people are getting injectable beauty treatments. Is that true of your experience?
Absolutely. I think it's been very clear. There's been a real surge in popularity in these treatments. We see more mention of it in the media. It's talked about more. And the other thing we're noticing is there's different categories of people coming in for treatment. So I think traditionally it was always seen as maybe something to, turn back the clock or as an anti-aging type of treatment. But interestingly, with the products that we're now seeing, we're seeing a lot of patients who come in for what we often define as correction. So this might be somebody who, for instance, has a part of their face they're not happy with. It might be, for argument's sake, a chin that they feel is not projected enough or maybe weak. And we can actually use these injectable products to give them some enhancement of a particular facial feature.
And are you seeing people who would perhaps in the past have taken a surgical route, take now a non-surgical route?
Well, I think the important thing there is to understand that what we do on the non-surgical side isn't there to compete with the surgical. So if somebody needs surgery, they need surgery. And this is one of the most important things we get through at Consultation. And what we find is that if people try and substitute non-surgical treatment for when they need surgery, there's often disappointment. Right. However, there's a number of options people will have, and in a consultation with a specialist, they may find that there are options that they can go down which would actually serve their purpose perfectly.
You mentioned consultation. I do feel that this is such a key part of the process. What other steps does someone need to take in order to get the result they want from non-surgical procedures? I think before we go on to talk about consultation, I think the research process is such a difficult part of the process because people now see so many magazine advertisements, they see newspaper advertisements, they can see before and after photographs on websites. There's so much marketing and so many practitioners. I meet readers who've been to parties and seen a practitioner, or they've been to a hair salon or a dentist or even a chiropodist.
I think from a patient's point of view, it's important to understand there's a journey, and that journey is quite long. It starts from just researching where to go. And, I sympathize with patients because at the moment, so many clinics can enhance, so many practitioners can enhance their reputations because it's quite easy to do, with an online presence. So the first thing I would recommend all patients or prospective patients do is real careful research. You want to know where you're going. And I think just as you would with any other service, you want to find out a little bit about the practitioner and the clinic. A really good route is word of mouth. If you know friends or family that have experience. So the number one thing is research where you're going.
There are so many different places now. How does one find that needle in a haystack? What are the signs that somebody is for real?
No, you're absolutely right. And I often joke with my patients that I think some people spend longer choosing what restaurant to go to than they decide what clinic to have some, treatment to their face. Yeah. I think it's important to not be taken in by hype and what I call tacky gimmicks or incentives. I think incentivization is to be avoided.
So, what would an example of that be?
An example would be a special offer, a discount. It's important to understand these are medical procedures, and in the same way that you wouldn't expect any form of incentivization for anything else medical, the same would be for aesthetic medicine. For instance, I know a lot of clinics or practitioners will promote themselves as, a clinic to the stars or celebrity doctor. I don't see the relevance there. I think what people should be looking for is what's the practitioner's knowledge, experience, what are their online reviews, and what is the word of mouth opinion on that person.
You talk about the importance of consultation. Of course, that's true in any beauty treatment, whether it's a haircut or an injectable treatment. What does that look like for you? Should somebody make sure that they are seeing the person who will administer the treatment, or is it acceptable to see a nurse or a receptionist? What does a good consultation look like for you?
I think the consultation is without doubt the most important part of the whole treatment journey. I would say even more important than the actual injecting itself. So I think you have to see the practitioner that is going to treat you. That could be a nurse, that could be a dentist, it could be a doctor. So, in the UK, the 3 classes of practitioner that are sort of empowered to inject are nurses, dentists, and doctors. Right. But the consultation must be face-to-face, in my opinion. I don't think a Skype consult or an email consult cuts it. And I think the consultation must be separate to the treatment day. So there must be a cool-off period in between.
Interesting.
Because what that does as a patient is it takes the pressure off. You can understand that if you've gone there and at the back of your mind, following that consultation, you might be having treatment, it puts pressure. And I think you need to remove that obligation and that coercion so that you're only going in there for information. And that's what consultation is. It's information gathering.
Can I talk to you about cost, please?
Absolutely.
I'm interested in the cost factor because I think lots of us take the view about all sorts of things in life that you get what you pay for.
You're paying for the knowledge of the practitioner, the experience, their skill set, but also how you're going to be looked after. And when things are discounted, there is always some degree of compromise. It may be in the quality of the product used, it may be in the aftercare, but ultimately you do get what you pay for. So I think the other thing I would definitely advise patients is don't just compare treatments based on cost alone, because it really won't be a fair comparison. Look at the person you're going to see. There is no doubt that some practitioners who have the experience of managing all aspects of that treatment will charge more, but ultimately that's the sort of reassurance that you're paying for, that you will be adequately looked after. So, like all things in life, there are products available and there's a range in quality. I would only inject in patients what I'd be happy to have in my own body. And unfortunately, we're now seeing a rise of cheap, badly manufactured products flooding the market.
So are you talking about fillers, for example?
Fillers, absolutely.
So what should be in there?
Well, most fillers that people use in this country have the same basic ingredient. We call it hyaluronic acid, or HA. So almost all fillers that people use are HA. But that only gives you half the story, because the manufacture is really critical. So when you are looking at these products, products that come from a company with a good pedigree, a good research and development department, and clinical trials and studies and safety data is what we're looking for. Now, there will be products coming in really cheap under the radar, and people are tempted to use them because, it's better for the profits. But ultimately, we want to be putting fillers in our injection treatments that actually have stood the test of time and have good scientific data for them. Because remember, now there are fillers that may last 12 months, 15 months, up to 24 months.
It's a long-term commitment, isn't it?
Absolutely.
Lots of the women watching and men watching will know what hyaluronic acid is.
So, for instance, there are so many times when you can have the same basic ingredient, but the quality can be vastly different. Right. So with the fillers, a good company product would be one that would last a good amount of time, would be easy to inject, will integrate into the tissues so that the expressions that people make after treatment are natural. So some of the cheaper products, what we're seeing is they may not last very long, and when they are injected, they may give a very harsh or unnatural appearance. And that's why I would always say that, it's your face, you really don't want to be taking undue risks with it, and that's why you want to combine good reputable product with good reputable practitioner.
And what about managing people's expectations? Can people, or should people, even hope for a dramatic, visible result? Or is the ideal result something that you can't detect?
I think it's more of the latter. And I think setting expectations is just exactly that. So I see a number of times, and this is usually this sort of light-hearted moment in the consultation, when what a lot of people will say is, I don't want to look different, but I definitely want to see a result. And I'll say, unfortunately, those two things are on opposite sides of the coin, But ultimately, what we want is to keep things as natural and subtle as possible. So our goal is to make somebody the best version of themselves. And the kind of comments that people really want to hear at the end of their treatment is from friends and family, people saying, you look great.
You look well.
You look well. What people don't want to be hearing is somebody saying, what have you had done? Or, who have you gone to see? Yeah. Because that probably means it's a little bit too much. Now, we have to manage expectation, because if you're after something which is going to keep you looking like you, maybe the impact won't be so dramatic, but that's not a bad thing. So these are the kind of questions that are answered in the consultation. So if somebody wants a very dramatic improvement, often it might be that they're really looking for a surgical option rather than a non-surgical option.
And so post-consultation, say if somebody's gone away and they've had their cooling off period and they come back, what happens then? Have you formed a plan in your head about what's going to happen during that appointment?
Well, to be honest, the plan ought to have been discussed at consultation. So the person should leave that consultation with a very clear treatment plan.
And you will have taken notes and made a plan?
Absolutely.
Right.
And it's not unusual, however, for the patient to still have some questions. So typically what would happen is they would have their initial consult, then they might book in for treatment, and I normally spend about 5 minutes before we treat them just to make sure that they've, again, firmly understood everything. And often it might be that there was a slight misunderstanding about exactly what was happening, and we can clear that up. One of the biggest things that patients should be made aware of is, consent, the kind of side effects or things that they need to watch out for. The risk of bruising, for argument's sake, which just may not have been touched on. And it may not be a deal breaker, for instance, but, it just might be that if somebody's working, they may have taken a day off, after their treatment. So I think everything the person needs to know should have been discussed at consultation. By the time it comes to the treatment, we can recap on that and then proceed to the treatment.
And would people typically be able to go back to work or be in work the next day, or are they talking about some downtime, or does it vary from patient to patient?
There is some degree of variation, but I have to say the vast majority, what's really lovely about the products we have now, they are really gentle, and the way that we can inject them is very gentle as well. So the vast majority of people could go back to work pretty much following their treatment if they needed to. Remember, we are putting a needle under the skin. Anytime we do that, there's a risk of a bruise. Typically, the kind of bruises we see are small, but I always tell people there is always the risk of a more significant bruise. We very rarely see it, but if that were the case, people just need to be prepared for that. But very rarely do we have anyone who just couldn't go back to work either that day or the next day.
There are so many different types of injection these days. Even I as a journalist read about a different kind of injectable treatment from 1 month to the next in glossy magazines, online and so on. And I do think there's a great deal of confusion among men and women as to what type of injectable does what kind of result does it give, what kind of problem does it fix, enhance, and so on. And so are you saying that during the consultation period, a good doctor should explain the different types of injections and what they are used for and what kind of result they should give? Because very often I think women think they want one type of injection when they actually want another.
Absolutely. The idea is to go into the consultation and just tell the practitioner what you're looking for. The practitioner's job is to explain why they're doing and why they're choosing a particular treatment. So we often go on about the aesthetic toolkit, just like a builder would have a toolbox with different tools, hammers and screwdrivers and nails. Each tool has a specific purpose, and we're the same. We have injectables, we have devices, we have lasers, we have skincare products, and everything will do a different job. So even within injectables, there are some injectables that might treat lines and wrinkles, and the fillers can treat so many different aspects of the face. So I, again, can totally understand it could be very confusing when you go in, but you should have a very clear picture by the time you finish on what is being proposed and why.
And finally, can we talk about topical beauty products? There are a number of beauty products which claim to mimic, sometimes exactly, the results of an injectable beauty treatment. Are those claims that you as a doctor buy into or not?
I think for the current crop of topical products, especially the ones that claim to mimic the action of injectables, we haven't seen anything that substantiates that claim. But topical products are very important for other skin issues like pigmentation, texture, tone, for instance. So again, a good practitioner will tell the patient exactly how their skin might benefit and advise the right product. But I would steer clear of products that make sort of wild claims.
And so you're using topical products in conjunction with injectables. So for example, if you're injecting hyaluronic acid, you're still advising patients to use maybe a hyaluronic acid serum or moisturizer and so on.
For me, as an aesthetic physician, good, clear skin is the holy grail. That's the ultimate aim. There's no patient I've ever met who didn't want good skin on their wish list. So with whatever other treatment we advise, we would always try and give some sort of product that can help improve both the texture and tone of their skin, for sure.
Thank you so much, Dr. Tapan Patel.
Thank you very much, Sally.